Good morning, ladies and gentlemen, and to our Malaysian friends, Selamat Hari Merdeka. Welcome to this RSIS webinar on Malaysia's policy response to COVID-19, drivers, players, consequences, with our two speakers, Dr. Azrul Muhammad Khalid and Dr. Muhammad Abdul Khalid. I'm Ariel Tan, Coordinator of Malaysia Program at RSIS, and I'll be chairing this event. You would have seen our speakers' bios and their long achievements in research, policy, and advocacy. But briefly, Dr. Azrul is the founder and CEO of the Galen Center for Health and Social Policy. He has a background in genetics and public health policy and has worked as a development and program policy specialist for more than 20 years. He is a co-founder of Code Blue, a health news website. He's also a board member of the Center to Combat Corruption and Cronyism, or C4. Dr. Muhammad Abdul Khalid is Research Fellow at the Institute of Malaysian and International Studies at University Kebangsaan, Malaysia, and a member of the Board of Trustees of the Malaysian Institute of Economic Research. He was Economic Advisor to then 7th Prime Minister, Dr. Mahathir Mohamad, and member of the Economic Action Council. He was Director of Research at Khazanah Research Institute and Head of Economics at the Malaysian Securities Commission. Both of them have worked closely with United Nations agencies, including the UNDP and UNICEF. They are published writers and well-known policy insiders. Now, through this event, we hope to get a better understanding of first, the policy-making process on COVID, the various parts of government and political leadership, and how they interact to make and implement decisions. Secondly, the goals, constraints, and mindset driving the response on the fiscal and economic front. Thirdly, the critical and longer-term impact of these decisions for the economy and society. They will each make their presentation. We will then have a roundtable discussion before proceeding to Q&A with questions from the audience. My colleague, Eric Santo Domingo, will moderate and relay the questions to our speakers. Please send in your questions using the Q&A function. This event is recorded and may be made publicly available later. Now, Dr. Azrul, please.
Thank you, Ariel. Thank you, first of all, to the S. Rajaratnam School of International Studies for this kind invitation to have me to speak to you this morning. I would like to firstly say that it's quite an honor to be here to speak on this subject, and certainly during these tumultuous times that we are going through, and today being Merdeka Day here in Malaysia, it certainly is something to be discussing. I would like to just dedicate my presentation to the people of Malaysia for whom this real success that we've seen in Malaysia's epidemic really is attributed to. Secondly, I just wanted to mention, I apologize for being on a panel, and I do hope that there will be efforts in the future by the organizers to be more inclusive. We should have women representation on this panel as well. Having said that, I would like to now just go on to my presentation and just say that it's best that we start with this particular slide before we go into the good, the bad, and the ugly when it comes to policy making and COVID-19 in Malaysia. And it is very important for us to consider the table that's being published today in Code Blue, the health news website that the Galen Center hosts. If you could look at the table on the left and look at the table at the graph on the right, you'll see that the only real success story that we're seeing right now is really in Labuan, where we see the positivity rates for COVID-19 is really less than 5%. The World Health Organization recommends a maximum of 5% benchmark positive rate as indicator of sufficient testing. And what is very clear is that, and which is why I wanted to start this presentation with this slide is the fact that Malaysia's epidemiology picture is actually an underrepresentation. It is being underreported and it's not necessarily showing an accurate description of what is going in Malaysia. And you can see there that even if you were to utilize the Ministry of Health's own 10%, which it considers adequate, most states in Malaysia are already more than 10% in terms of positivity rates, essentially telling us that in almost every state in Malaysia, there is under-testing. Therefore, there is under-reporting of cases in Malaysia, and any attempt to change the goalposts has been to naught, simply because we have exceeded more even than those parameters. And this is a point that has been indicated by public health experts as early as May last year. So this is not something that we just came into realization. It's something that's been known since last year by all parties involved. There is also an indication, if you notice the Klang Valley, Kuala Lumpur and Selangor, Putrajaya and so forth, if there's been any kind of positive indicator, it really is as a result of the Operation Surge Capacity, which was a huge effort by the government of Malaysia to try to increase the vaccination rates for the Klang Valley, but it did come at a price. Almost every state outside the Klang Valley suffered from there being low vaccination rates, as well as skyrocketing hospitalization and also deaths. So basically Malaysia, if we consider the fact that we are actually, despite no real official acknowledgement of it, we are actually in the fourth wave of the epidemic. There's a large number of brought-in deaths. Around 50% of them are foreign migrants, telling us something with regards to the way access towards vaccines are still incomplete. And having said that, though, it is quite interesting to note that Malaysia is actually one of the few success stories in this region when it comes to vaccination, with more than 80% of the adult population having at least one dose and 63% completed with 2 doses as of as of yesterday. So, you know, this is a mixed bag and certainly something that we have to look at, but it is important that we see that much of the data, that even what you can see on this slide, is an underrepresentation. I wanted to just make a special note here that we are monitoring a few worrying states, and one of the states that we worry about quite significantly is Sabah. And this is something of a deja vu for a lot of us who have been monitoring this epidemic, because last year Sabah went through their state elections and experienced one of the worst outbreaks in the country. Somehow we're back in that situation again. And if you can see the positivity rate for Sabah, if you thought more than 5% was bad, a few days ago, Sabah was 24%. So the situation in Sabah is basically indicative that we are under-reporting for Sabah, but also that the number of cases that have been detected are really very much in the community that's still yet to be seen. One thing that's interesting, which I forgot to mention in the earlier slide, is that when we see the trend concerning testing and positive cases, we see the testing dip every weekend. So, you know, it seems like we take a break every weekend and the testing rates drop, and then it goes up during the weekday. So unfortunately, the data that we see from Malaysia is very much affected by non-clinical related issues, but also when people are taking breaks or having days off and so forth, or national holidays, God forbid. So you can expect that today's testing data is going to drop at an all-time low for Merdeka Day. The other state that we're looking at, and this is of interest for your colleagues here this morning, is Johor. Johor is actually one of the better states, but even better, when we say better, it's really relative. So you can see their positivity rate as of a couple of days is 9.5, but just less than a week ago, it was actually 13%. So this is actually a worrying development when it comes to Johor, but Johor at least has not experienced some of the more worse conditions of their testing, as well as number of cases in that state compared to North states in Semenanjung, which have experienced quite a a massive load of cases, number of hospitalizations increased, number of deaths also increased, as well as number of cases. So the thing is right now is that Johor is able to manage the caseload as it is seen in the state at the moment. But again, we really are unclear exactly what the situation is on the ground. So I wanted to start off with, of that and going on to the issue of where we have done well, the good, what we have not done so well, the bad, and really the ugly stuff. So the good. Interestingly, Malaysia, when we went into the COVID-19 crisis, we came from a position of strength. It's one of the few countries in this region, in fact, the world, which was rated highly in the Global Health Security Index that's put together by the Economist Intelligence Unit, School of Public Health and Johns Hopkins. And Malaysia was actually third on that index for Asia. In fact, better than Singapore, I would say. And this is because Malaysia has had a lot of experience in dealing with the previous outbreaks of Nipah, H1N1, SARS, MERS. So when it comes to public health, when it comes to communicable diseases, Malaysia came from a position of strength. So a lot of the early response can be attributed to that. We saw this in the leadership that was demonstrated by the Ministry of Health, especially by the Director General, the way that it was being done, the kind of clarity in terms of messaging, the kind of issues that were being raised, the kind of efforts to instill behavioral change amongst a population, which anybody who works in public health will tell you is one of the hardest things to do. Behavioral change is hard to do. So we saw that coming out from the Ministry of Health. Unfortunately, this later suddenly changed its tune from June onwards, where it started to deteriorate in terms of leadership. We'll talk a little bit about that later. KJ, the Khairi Jamaluddin, was vaccine czar for basically the beginning of his term. He took on the vaccine portfolio almost from the moment he took on the Mufti position. I think I remember there was early discussions back in April last year where the discussions concerning vaccines was first initiated, although there weren't any at that point of time, but even up to July, there was already some initial reach to vaccine developers such as those in China to see what could be ascertained. But he really came into his own from August onwards and basically spearheaded the vaccine effort for Malaysia. We are where we are today is largely to some of the bold and gutsy decision-making that was made by KJ from August onwards. In terms of communications, as I mentioned just now, the clear and coherent public health messaging, especially concerning outbreak management in terms of vaccines, over the past couple of months have really been attributed to how well the communications has been done, especially by the Ministry of Health, in terms of trying to articulate to the population what needs to be done, what cannot be done, what the SOPs are, what needs to be adhered to, how do you protect yourself, etc., etc. But this is really due to the guidance by the public, the strength of public health experience in terms of managing communicable diseases by Malaysia's Ministry of Health, which basically translated into very clear messaging when it comes to these issues. What happened later on is a consequence of inconsistent messaging, but at least at the very beginning, we saw clear communications, which until today was able to deliver very strong adherence and compliance to SOPs. Malaysia had one of the highest compliance SOPs in the world. I think ours was more than 89% consistently last year, which when you compare to other countries like the UK, US, Australia, which had poor compliance, needing different measures, but Malaysia as well was basically quite high, and this was really attributed to the communications. So the bad, I put out the image there, the infamous theyre, which I felt was quite a arrogant message that was being put out, especially since we knew that we were underreporting and there were many cases that we were not seeing simply because we were doing so-called targeted testing. And consider this, 8 July 2020, supposedly 0 cases in Malaysia. And consider where we are today, where we are seeing more than 20,000 cases a day. That's how drastic it has turned from that to what we see today. And this is really one of the problematic aspects of Malaysia's response last year, and to some extent even this year, is that complacency that could be seen amongst the Ministry of Health even, as well as the government. You know, they were looking at New Zealand and Australia and thinking, okay, Malaysia can do this, we can do 0 cases. And to be fair, Malaysia's past experiences when it comes to infectious diseases, it was possible to do that. It was possible to get down to 0, but COVID-19, even with wild type, before even the variant came out, is a different animal altogether. You know, it requires respect, and certainly it has an infectivity rate that is far higher than any of the other previous diseases. So Malaysia was really looking at not so much managing, but more of eliminating or eliminating the disease altogether. And to some extent, that early thinking pervades even into today. If you look at the National Recovery Plan, you can see elements of that thinking in the National Recovery Plan, which, you know, when we first saw the NRP, I just couldn't believe that that was being put forward, because it just wasn't realistic and it just wasn't possible. The complacency also drove the early thinking concerning vaccines. It was thought, even at the government Ministry of Health level especially, it was like it wouldn't be available by end of 2020. There was a lot of suspicion amongst the people at the ministry concerning mRNA vaccines, and their preference was really the inactivated virus model. So you saw a lot of advanced conversations with the Chinese manufacturers of the inactivated virus models, but almost no real discussions being led by the Ministry of Health with the non-inactivated virus, so mRNA vaccines as well. And in fact, there was at one point, somebody at the senior government level, I won't say who exactly, even said that it might not even be necessary to have a vaccine, because we'll be able to eliminate the virus altogether from Malaysia. So that was concerning complacency. There's a lot that we can talk about, but I just wanted to mention these points. Also, what really worked against Malaysia was the public health advice, which we know of right now, which was perceived to be misused for political agendas. And this is something that is quite worrying, because it contributes to the widening deficit of trust that we see that is being experienced right now when it comes to you know, looking beyond the COVID-19 early response to one that is looking towards living with the virus, considering it as an endemic rather than something that can be eliminated altogether. And one of the reasons for why this has occurred is really because of how public health advice has been seen as a tool to sort of delay or abruptly end parliamentary sessions, as we saw in the recent short-lived parliamentary special session. Also to delay the holding of parliamentary sessions in the past, where COVID-19 was used as an excuse, yet somehow or another you could organize other political related events, but you couldn't have a parliamentary session. You know, you could have weddings, but you can't have parliamentary sessions. You can have everyone in parliament vaccinated against COVID-19 with an mRNA vaccine, yet you still couldn't have parliamentary sessions, and the reason being that it could spread COVID within Parliament House, and it's been seen as being used for political agendas. A lot of the COVID-19 advisories today suffer from the perception that it's arbitrary, that it's not based on evidence. And this is really when you look at what happened last year with regards to the Sabah state elections in terms of the quarantine that was being imposed. So for the politicians, somehow they didn't need to be quarantined. They could just go straight from one airplane to another state without even needing to be quarantined from having been in Sabah state, but able to go into the peninsula without having any kind of caution concerning their level or status of COVID-19. A lot of the advisories now are having to justify themselves because they're seen as being used for a political gain rather than one that's based on evidence. So we have, for example, even good things like reopening the economy to where we are right now. You know, I mean, the NRP, the use of the NRP phase 1, phase 2, I mean, they just don't make sense anymore. It really is seen as if you want to open it, they'll just open it regardless of whether or not it has any bearing with in relation to the COVID-19 situation, and the Director General of Health mentioned that briefly when we reopened last week. Interestingly, a lot of the policy missteps included even paying for the vaccines themselves, that because of the earlier complacency and the thinking about vaccines, shockingly, the allocation for vaccines was not in the supply bill, the budget 2021 at all. And neither was the commitment for COVAX for 164 million. It just wasn't in there. We looked through the actual budget itself, and it wasn't even in the temporary measures for government financing, which is the Act 830, which provides for a huge chunk of money to be spent on COVID-19 response. So it was a huge misstep, and it was really guided by that complacency, the really lack of confidence in vaccines, resulting in Malaysia being in wrong footing when it comes to vaccine procurement. But basically, it was announced earlier this year that the allocation would be tapping into the national reserves, which was the Kumpulan Wang Amanah Negara, or KWAN. So having said that, though, where we are today is really as a result of aggressive action by KJ, which enables us to be able to get to where we are today. The ugly stuff really has got to be what is well known, is that there are double standards. There's one version of SOPs for seemingly for politicians, VIPs, ministers, deputy ministers, senior officials, where fine seems to be just short of causing you to be disqualified from being in parliament or losing your seat. Yet for ordinary people, it would range up to 10,000 ringgit, 1,800, 3,000 ringgit, and so forth. People are able to have gatherings. You can see there, Anwar Musa there, indulging in a feast at a time when such feasts were not permitted. So we even had a minister who was not observing SOPs, who was in fact spreading infection from one state to another. And this was as a result of non-observance of the SOPs, which he didn't even really feel the need to wear the face mask properly and so forth. One of the things that's really drastic is concerning the role of religious events. One of the questions that have been asked frequently amongst us here is that despite high vaccination rates, despite multiple lockdowns, despite aggressive action, somehow we are seeing 5-digit numbers, 15, 18, 20,000, considering the fact that when we were talking about this a few months ago, we were really talking about 3,000 cases. Suddenly it's now 16,000, 18, 23,000, and so forth. And really that's got to be attributed to the religious events. I have to say that there's been a difference between how the Muslim and non-Muslim places of worship, bodies observe and adhere to SOPs. The non-Muslims have been very strict, especially churches, temples. But when it comes to Muslims, because they're guided by the government, there seems to be some sort of leeway that's been provided. So you can see here on the lower left there, sorry, lower right, that just a few, I think, month ago, somehow even a mosque was allowed to have 300 people in the congregation, even though they were practicing SOPs. But that's 300 people, congregational prayers being permitted. And this was last month, well, in July, for the Adil Adha. But you can see that it's for the daily prayers, for the Friday prayers, and Adil Adha prayers. But what really made a difference has got to be this one. And this is going to be almost the last slide that I'm going to show you today, which is a misstep of policy, which has resulted in this huge wave that we're in right now, that we're surfing as part of the fourth wave, is if you look at the start of Ramadan, which was around, I think, April 12th or so, you can see the cases slowly increasing and continuing to increase, and then all the way up to where we are today after Eid al-Adha. And you realize that Ramadan, where every night Tarawih prayers were permitted, where congregational Tarawih prayers were permitted for surahs, mosques, and so forth, it resulted in multiple spreader events. Really, they played a role in making sure that COVID-19 is embedded in the community to the point that there is no return from having to see some of the policies and measures that worked in the past after Ramadan, you just didn't see them really working anymore, simply because it was too firmly embedded. 1 month of Ramadan, after that, Hari Raya, and you can see the cases going up exponentially all the way up to Adi Adha. And today we are where we are at more than 20,000 cases. So I really have to, it's not official, but when we are able to do proper studies with data that MOH is able to provide, we will likely find that the religious events of Ramadan in 2021 was basically essentially the start of where we started to see the fourth wave being as large as this is today and where Malaysia is today. So I just wanted to make that point because that's quite important as from a policy misstep. And when we compare Ramadan last year and this year, it's day and night, and certainly something that is quite unfortunate. So I wanted to leave it there for the moment, and I'm happy to take questions later on after Dr. Muhammad. So thank you so much.
Thank you, Dr. Azrul. And now Dr. Muhammad, please.
Thank you, Ariel. Good morning, everyone. First of all, thank you to RSIS for the invite. It's an honor to be here with Azrul and the rest of you on this morning, Merdeka morning. Maybe I'll share quickly Malaysian policy response to COVID in terms of the economy. What are the implications? And how do we reach there? Allow me to be frank and honest as possible, so it can be useful to you all this morning. I think the response has been short of disaster, really a disaster, both in terms of health and in terms of economics. In terms of health, perhaps Azrul can share later on. When we look at the number of deaths in Malaysia, we take example yesterday, one Malaysian or one person died every 4.5 minutes. If you take now the number of deaths beginning of this year is about less than 500. Now it has increased to 1,700 people, 17,000 people. It has increased a lot, and the rate of death is one too many. Can you imagine for a second? Yesterday, one person died every 4.5 minutes. How is that possible? How can then we say we are successful? We are not. Every day, 300 people die. This is clearly unacceptable, and it shows, if you want to look at the results, I take a look at the results in that sense. And no other indicators would tell us that we have done better in terms of health. Despite that, like Azrul mentioned, in the first half of last year, we did extremely well. We did better than, in fact, better than Singapore, because we communicated well, we had good system in place, and we learned from previous experience. Even as early of December 2019, we activated the crisis response team. We renovated some hospitals, designated some hospitals who we prepared, but unfortunately, we have failed to maintain that momentum. In terms of economy, it's equally bad. I would not look at GDP numbers. GDP numbers this year are going to be slight positive for simple reason, because last year was negative. So we are starting from a very low base. Even next year, well, again, it's going to be quite a low base. So I forget about GDP. But even if you look at GDP, the size of the economy has shrunk. Even if this year it expand by, the government thought 3 to 5-6%, the size of the economy, if you take this as a cake, is still going to be lower than 2019. Even this year we have a positive, it's still going to be lower than pre-crisis. And we expect that even by next year, the size is going to be smaller than pre-crisis. So we have pushed back economic development by about 2 years, 2 to 3 years. This is for Malaysia. But COVID make it much worse to poorer states, to vulnerable groups. You take, for example, Sabah. Sabah economic development in terms of GDP per capita has shrunk to the level of 2016. Gone 5 years, as if 5 years has nothing happened in Sabah. In Terengganu and Kelantan is the same thing. So even that we recover in terms of economic growth is still going to be lower compared to pre-crisis. And for certain states, Sabah, Terengganu, Kelantan, it pushed back by 4 to 5 years. So we look, let's not pay attention much to GDP. GDP is important to measure growth, but does it make people recover? Is it better for social mobility, inequality, poverty? I don't think so. And this is where COVID hit people the most. It hit the vulnerable the most. If you look at the labor market, last year, the unemployment rate, this year, as of July, May, June, as of June, unemployment rate remains high. It still remains among the highest in 30 years. How can we say that we have recovered? And if you look at the number of unemployed compared to last year, it went up by 41%. Number of underemployed, even if you have a job, there's a high chance that you are underemployed. Either you work less hours or you work jobs that don't require your qualification. The number of underemployed percentage went up by 82%. And therefore, when you have excess of labor, wages went down. Wages last year went down by 15% on average. That is the worst in 10 years. The past 10 years always went up. This is the first time it went down by 15%. And the worst affected, because of the impact in the labor market, is the young. The youth unemployment rate is 3 times higher than national average. And this also includes those with tertiary education. The tertiary education educated, the number of people who are unemployed who have tertiary education went up by 22%. And what's the implication? The implication, you're going to lose a sizable power of purchasing power. Who is going to spend? The middle class has shrunk. That's why you see a certain group of M40, the income. Now, if the cutoff remains the same, they've already been in B40. So that's the middle class. The young graduates, the future middle class, also have an issue. COVID, the entry level, the wage, median wage for young graduates has dropped by 25%. Now, if you're a graduate, your salary is going to be only 300 ringgit different than the minimum wage. Minimum wage is 1,000 to 1,250 for urban. But if you are a young graduate, your salary is 1,550. Only 300 different. And this is a new middle class. Many of them do not have jobs. Even if you have jobs, you'll be underemployed. And even if you are underemployed and you have jobs, your salary is going to be very low. Where the future purchasing power going to come from? So we have a serious issue that because of the impact to labor market. Another group that's going to be a future good labor force is the children. Now, we know the crisis, UNICEF did a study and published, which we did a study for them. When we did a study for kids in low-cost flats here, 50% say they are stressed. The parents say the kids are stressed. They cannot study. About 20% say, I'm no longer interested in school. We already have an issue of kids who are stunted, which is about 1 out of 5 stunted, underweight, which on the increasing trend. This is before crisis. Before crisis, stunting has been going up. Underweight has been going up. Crisis make it worse. The study that we did for UNICEF, the percentage of households that says that they consume more instant noodle, Maggi mee went up by 40%. Maggi mee went up, rice went up. Fruits went down, protein went down. So you will see the level of stunting gonna go up. So it's not something I'm short of 2 inches. It's a development here. So you have, and you, on top of that, you have difficulties for online learning. 9 of 10 do not have equipments. And if you look in poor states, again, in Sabah, for instance, in rural areas, only 5% has fixed broadband. Then how do you expect them to do online learning? School is supposed to be open next week, but probably online, and it's going to be difficult for the young kids. Another group that has been affected quite bad are the self-employed. In Malaysia, we have this term, makcik kia, but we've forgotten about her anymore. We do not know what happened to her. Maybe she's already dead. We forgot about her. There are about 2.4 million makcik kia self-employed in Malaysia, and there has zero protection. Out of 2.4 million, let's say there's 100 makcik kia in Malaysia, only 3 would have accounts with Social Security Organization. which means if they lose just job or they get accident, only 3 will be covered. 97 are not covered, and we do not help them. And this, again, all these things, that statistics I mentioned to you, this is not new. This is already there before. We do not protect enough. Social protection weakness already there. COVID make it was COVID exposed on. And because of this, labor market issues, self-employment problem, wages come down, poverty level went up. Last year alone, we added roughly 1 million people into poverty. Last year alone, additional 1 million people. So the poverty rate went up. Poverty rate has not gone up for the past 50 years. Malaysia is one of a good case studies on the eradication of poverty. But last year, it went up. And again, those affected are the poor states. Before COVID, the absolute poverty rate in Sabah is about 20%. 1 in 5 considered poor. Now 1 in 4 consider poor. Kelantan, another poor state. Before COVID, 1 in 10 considered poor. Now 1 in 5, it has doubled. Terengganu, poverty rate doubled. So the poor state are most affected. And therefore, you see the level of inequality has gone up last year because of COVID. The income share of B40 went down, income share of M40 went down, income share of T20 goes up. Even if we recover, they're going to be K types of recovery. Small number would do well, a lot would not do, would not recover. And this is an issue that is dangerous if not mitigated for countries, multiracial countries like Malaysia. The question is then, in one of the questions that Ariel posed yesterday to us, would we recover? Can we recover? What's the role of the budget? What's the role of 12 Malaysian plan? It's going to be extremely challenging for us to recover. Look, Malaysia is like Singapore, is a trading nation. World Bank, IMF says next year is not going to be that fantastic, low growth. And many countries, developed countries that Malaysia trade with, already started to claw back stimulus measures. Those that they spend a lot this year, they're not going to spend again, number one. Number two, you see the interest rates to go up. Because during crisis, everybody cut. And last Thursday night, South Korea, one of the first countries in Asia, increased its interest rate. Sri Lanka did a week earlier, Australia did also increase interest rate. In Malaysia, it expected early first half of next year, first quarter, you will see interest rates to go up. So it's going to be challenging for people to spend globally, not going to do well. Domestically also, because Malaysian economy 70% driven from private consumption. Me and Azrul spend. We buy baju, we buy pen, whatever. We drive the economy. Who will spend next year? If you look at the labor market, it's not fantastic. Wages has gone down. Many have exhausted their precautionary savings. So the savings, because the past 1 year, we have used up our savings. We also, unfortunately, almost many of us has used up our forced savings in terms of our money in EPF or equivalent to your Central Provident Fund. I think this is the biggest mistake the government has made during the entire COVID period. In terms of all the policy decision, this is the worst. In Singapore, it's almost blasphemy to say, let's take the money from the retirees. But we took it out. And because of this, about 38% would have less than 38% of those that have money in EPF. Labor force is about 15 million. Those who have regular money in EPF is about only 5.5 million that regularly contributed. And from that amount, about 38% we're going to have less than 1,000 ringgit going to retirement. So not only many do not have an account, those who have an account, almost 1/3 already clean up. And a survey done by EPF, why do you withdraw? I need money to eat for household expenses. So you do not have precautionary saving, use your forced saving, which means you're going to have a problem later on, retirement crisis. And Malaysia is going to aging nation. So how people like household, not Azrul is doing well, other people are going to spend. There's no more stimulus, like I said, for B40 and 40, there's more cash, special cash assistance. How about firms? So if I do not spend, firms, how can firms spend? The government assistance, so far about 100,000 has closed shop. Data from the government, 100,000. And the Ministry of Entrepreneurial Development, just before the cabinet government collapse last month, it says if the current lockdown continue until next month, about half of the small and medium enterprises will close shop. That means 7 million people will be unemployed. That's the minister statement. If close shop. The government did help through wage subsidy, like what Singapore did. But the problem is the amount is too small. I'll give you an example. Every month, the entire wages that be paid to employees in Malaysia is about 25 billion ringgit. Well, roughly 25 to 27. Let's say 25 billion. The government gives wage subsidy on average about 1 billion a month. 1 billion of 25 billion is 4%. In other words, if my cost is 100 ringgit, the government gave me 4 ringgit. Does that incentivize me to keep the workers? No. Would that make a big difference? No. Singapore, I don't like to use the example of Singapore, but since the whole Singapore give an example of Singapore give up to 75% to those who are affected quite badly. We give 4%. So firms also not doing well. Wage assistance do not help. The wage assistance, the one that was announced early last month, only gave to about 2 million workers. We have about 15 million labor force. In terms of employee, about 10 million. It's too small to make a difference. So even in firms, it's going to be a challenge. So if private cannot spend, then neither group that can spend is the government. Unfortunately, government is not spending, or rather they spend on ridiculous stuff. The fiscal assistance, been finance minister like to say one of the largest in the world, actually is not true. Direct fiscal injection from the government is very low. It's about 7%. Thailand spend more than us. Singapore spend 3 times higher than us. We spend too small. In fact, people spending from intervention from the withdrawal of EPF is larger than the entire government stimulus for the past 1 year, for the past 15 months. If you add loan moratorium, that's if you add loan moratorium and withdrawal from EPF, that's 4 times bigger, 3 to 4 times bigger than the entire fiscal intervention. We spend too small. Therefore, I would not see that there be recovery, equal recovery for everybody. Why do we do not spend? This is where policy comes in. Key players do not, the one that we have, do not believe in spending. Maybe the background bankers, not that smart, do not believe in spending, because he thinks when we spend it's a lost money. It is not. It is an investment. If you spend to firms, you give to household, they would spend, they go buy stuff, firms do well, firms pay tax. And if you look at history, the debt level, the deficit level in Malaysia is still lower than 1986 crisis. 1985-86 crisis, the debt level is double than this. But within 10 years, we managed to reduce the debt. The fiscal deficit become fiscal surplus because people have jobs, people can spend. Would this change? Would government still spend? They would not spend, because when you hear, it says we are recovering because we're using GDP as one of the indicator. And who decides? We do not know who decides actually. We have National Recovery Team. Coordinating minister is Finance Minister. We have Economic Council. We have Cabinet. 3 different agencies. Who decide? We have no idea. But we know some personality-driven policy, and in our case, is unfortunately is the Finance Minister. There is also, I think it's going to be better. I hate to say this, but it seems to be lack of empathy to help the people. When people say, when government announced lockdown, people demanded that there be a loan moratorium. The government said, I cannot give you loan moratorium, which is an oxymoron. If you do not me to go out, how do you expect me to go out and earn income? How do you expect me to pay my loans if you want me to stay home? The response for the finance minister at the time is quite arrogant. Even if we can, doesn't mean we should. It's very, very arrogant. But because of the pressure after 1 month, they announced moratorium. So there's a lack of empathy towards what is happening on the ground. And this, together with lack of confidence in terms of policy making, in terms of the leaders, then we're going to have problem to recover. One of the question in the chat, it says, ask about the cabinet. The new Prime Minister has an opportunity to instill confidence. All you need to do, you cut the cabinet, you get new guys, regardless from, even from UMNO, get good guys, young guys. But it's the same bloated cabinet, 70 people, which means when we say we have no money, but we spend on 70 new ministers and deputy ministers. And the new deputy ministers that we put in, 5 new ministers, 3 from UMNO, 2 of them have court case. 1 have because of stealing, become a minister, and 1 have, unfortunately, issues for molesting a child. And they're in cabinet. Would this instill confidence? I don't have to answer, you can answer. Again, but let me be straight. This is not the cabinet that the Malaysian decide. These people do not win. The party did not win. It does not represent the Malaysian people. Can it get better? I think it will. Malaysians has now adapt to changing governments. There's no qualm to be loyal to any party. And if the current policy continue, I don't think this government also would continue. As it is, it only has 3 seats, a majority. So political instability will also remain there. Maybe I'll stop there and I can take questions later. Thank you.
Thank you. Thank you both, Dr. Muhammad and Dr. Azrul. May I start off with a question to Dr. Azrul, if you could unmute yourself. My first question is, could you just draw apart the curtain a little bit on policy making and share with us how is policy being formulated? Where are the inputs? How are they formulated? How are decisions being made? Between the policy makers, the public servants, and the political leaders. We've heard of the role of the National Security Council, which is chaired by the Prime Minister. We have coordinating ministers, and Minister Ismail Sabri was the coordinating minister at that time, and he was addressing the public every day. So could you just demystify the process for us a little bit on the respective role of the public servants and the politicians? Because I think there's been a lot of attention on the politicians. They get most of the bad bricks, but how does the process work? Thank you.
Unfortunately, it remains a mystery. It's hard to draw the curtain over some process which ideally should be evidence-based and driven by firm recommendations which have understood outcomes that tend to not take into consideration things like political issues, cultural, religious values, and also sometimes even economic issues. So unfortunately, many of these factors come into play during the National Security Council meeting. We get this sense, like last year early on, that there was a need to paint a villain to sort of distract the attention of the Malaysian public from the sort of lack of ability of the government to manage the outbreak. And last year, what began was a campaign over several months to demonize migrant workers as somehow being the cause or the source of COVID-19 cases. And that has extended all the way up until today. And that's not provided through by any kind of evidence whatsoever at that point of time. In fact, the immigration raids, the conditions of detention, the kind of vulnerable situations that these migrant workers were put under actually placed them under immense risk and vulnerability towards COVID-19 infection. So it resulted in them getting infected rather than protecting them. So the problem right now is there is a lot of romanticization concerning technocrats within the government having to fight with the politicians to get their point across, and that somehow the technocrats are correct, but the politicians are not, and it's painted that way in a sort of antagonistic way. But the reality is that they are themselves having their own agenda. Even the senior civil servants have their own agenda, and somehow they do not see the issues on the ground in the way that Dr. Muhammad has articulated. So sometimes their own recommendations are not in sync with the harsh realities on the ground. So for them, it's easy. They get their salaries each month. They don't have to worry about hardships of feeding their family, putting food on the table, going out to work, so forth. And then they recommend these harsh measures that are intended to put everybody under lockdown for several weeks. And there's no mechanism of support for them whatsoever. And somehow you're expecting people to comply and cases to go down. And the reality is that there seem to be no real coherent and consistent decision-making, even until today, where you would actually be able to say this was evidence-driven. A lot of it has a lot of political issues. Even the fact that the ministry did not want to consult people from outside of the ministry or outside the group of people they have was a problem, because they only were basically looking at their own people, listening to their own advice internally, but didn't really want to consult the private sector, the economists, the public health experts that we have. And it resulted in very confusing and incoherent policy making that resulted in a tremendous harm. I'm always concerned about the number of people who actually took their own, died by suicide that we've seen over the past several months that have been extraordinarily high. And there's no support for them. There's no support for mental health. In fact, funding has been reduced for mental health. There's no support really for providing people who are under lockdown with measures that make sense, that provisions that make sense. You know, it's just a mismanagement. It's a tragedy, is what I'm trying to say when it comes to the management of this COVID-19 crisis. Not just about the disease aspect, but the non-disease as well. So earlier on, we started well, and then somehow from June onwards, it just went downhill. The only bright light that we see right now is the vaccination program.
Thank you. But can I just try my luck and see if you could enlighten us just a little bit? Most of the time, the politicians feel the heat from the public directly because they have to win elections, and they are sitting on top of the public service. So why is that connection not kind of working in a sense? Because, you know, public servants are not voted in, but politicians certainly are. So why is there no pressure from the politicians to make sure that the policies implemented do not hurt the people and hurt their own political future?
I'm sure Dr. Muhammad has something to say about this question, but I'm going to just say it first. You're assuming that the politicians know what they're doing. And the problem was that when we looked at the cabinet, the previous cabinet, which is basically version 2.0 this time around, they just didn't know what they were doing, you know. In fact, the only ones that the only thing that we saw that they were hoping for was that the Ministry of Health would get its act together, KJ would deliver a miracle, and somehow or another people will forget it once everybody gets their salaries, able to put food on the table, sun comes out the next day. And, you know, Malaysians have short-term memories, right? So they're just hoping that when everybody gets vaccinated, everybody will just forget about it and we can move on. And that has been the pattern for other tragedies in the past, you know. And the reality here is that, I'm sorry to say this, our people in the cabinet, 3/4 of them, I would say, do not know what they are doing in the portfolios that they're holding today. And that is a tremendous threat, because in order for Malaysia to be able to come out from this public health emergency intact, everyone must work together competently, knowing where they fit into the public health response in their respective roles, and not just look at KJ. Now it's KJ as the health minister, right? And look at him like he's the Messiah or Jesus, you know, coming down, or Muhammad, sorry, maybe not Jesus, but, you know, somebody coming down from the mountain, and giving deliverance, and that's the worry here, because this personality politics plays a lot. It plays a great deal in the Malaysian scene. So right now, worry is that they're looking at a certain individual to be able to deliver the kind of results that they want, which they have to all work together to deliver. But they're just going to say, once they reach 80% of vaccinations, for example, they're going to say, oh, we settle, everything's going to be okay. Let's reopen the economy. Don't have to worry about anything from now on. And that's the worry that we're going to see once they hit the 80% mark. Thank
you. Dr. Muhammad, would you have a view on that?
No, before, I agree totally with what my friend Azrul said. They do not know what they're doing. There's no inclusiveness in decision making. If you notice, if you remember a couple of months ago, almost key Chamber of Commerce wrote a letter to say, listen to us, you're not listening to us. Even the most polite chambers, Japanese, they never say anything for the past 40 years, they keep quiet. They send a letter to the Prime Minister and says, what's going on? Our issues are not being addressed, you're not listening to us. The process of decision making is not inclusive. And if you say, and the issue that we say, spend on people, spend on firms or health mitigating factors, this is not new. People have shouted since last year. And if you say something different, you've been seen as an enemy. You're not being seen, let's work together. I'll give a simple example. When the first lockdown happens in March, April last year, 2 months after the government change, few of the economists wrote an open letter to the Prime Minister, including one of the top economists of the country, Malaysian, who at the time works as a chairman of a research institute under the government. The letter was published in the morning. If I'm the minister of the government, in the afternoon I call of them, hey, tell me, why do you say this? How do we work together? That's not what happened. There's a topmost economist of the country, on par with Jomo. What happened in the afternoon? He got sacked. And he's not even a politician, because he says something slightly different. He says, spend more, this is what the government do. So there's a mistrust. It's like George Bush, either you with us, you're against us. And this will continue. We don't see any, the cabinet is a perfect example. You don't bring anybody new there to say, okay, let's step back and how are we going to do this differently? Like Azrul said, the cabinet is the same. In fact, I would say it's much worse than previously. We are in, or the Prime Minister or those who appoint Prime Minister are in denial. And election is another 22 months. For them, it's okay, it's still honeymoon. And previously, it's not their government. UMNO said it's not my government. It's Bersatu government. MITI is Azmin. Finance Minister is Mohidin's guy. Prime Minister is Bersatu. It's not UMNO. That's why the terms kerajaan gagal come from UMNO. So I don't care what they do.
Sorry, Ariel, could I just add on? I think one of the missteps also very early on in the outbreak was the delegation of the responsibility to the National Security Council and framing this public health emergency as a national security concern. And then you've got all these characters who are looking at it from a national security lens rather than a public health emergency. And the mobilization of, the military, national security assets in order to address or to pour resources into the public health infrastructure. And I think that was a mistake in itself, which created the need to find sort of an enemy later on, which resulted in the victimization of the migrant worker population. And this is something that, when we re-look at how we responded, that's going to be a major misdirection, which poured so much effort, resources, and created clusters of infection, out of a population that didn't really have that many to begin with. So, we have to wonder what exactly are these guys up there able to do other than to justify their own existence and roles and find a way to create issues, rather than concentrating on the public health aspect itself. You know, we have people who are dependent on in critical jobs, like the Ministry of Women, Family, Community Development, for example. It's in good times, this was a snooze, you know, it's a sleepy ministry. It's not really considered that important. But during a public health emergency, such as this one, it's up front, you know, and you've got to, and you have to deliver critical services. You know, you have to help the B40. You need to make sure that people are not dying as a result of the lockdown, able to get the provisions needed and provide assistance. And yet the minister in question, you've got to wonder whether that person's competent, you know, and that's a terrible thing to think about during a time of crisis. And she got reappointed, by the way. So, I mean, great.
Can I ask you about the federal government and state governments, their communication and coordination, and was the fact that is the fact that some of the state governments are under opposition an issue? So we did see a lot coming out of you know, the kind of friction that emerged between the Selangor government and the federal government. But you know, in the end, there was a surge capacity exercise, and hopefully that sorted things out. But could you shed more light on the sort of coordination between the states? And you know, is coordination better with, say, Johor or with Sarawak as a result of there not being that particular issue? And thank you.
So you're asking Dr. Muhammad or myself?
Primarily you, but also yeah, but Dr. Muhammad could start first if you have anything to say.
Well, let me just say first that this has been a contentious issue because health falls under the federal list, and under the federal constitution, it is the federal government that's tasked to do it. And in the past, state health departments basically are subordinate to Putrajaya in order to respond to something like this. But this is one public health emergency where we just couldn't and still cannot afford this kind of I would argue, Soviet Politburo type, you know, centralized way of thinking. You just can't, you know. You got to have a situation where the state health departments are able to manage their epidemics, manage their resources, manage their people in a way that almost argues for decentralization. In fact, the Galen Center for Health and Social Policy, our position has always been that we have to decentralize health, you know, with the federal government in support of state health departments, and we need to strengthen the state level. But the problem right now is because of the different political polarized dynamics that you see in some states, you end up with this absurd situation where the state government is not shared information by the state health director because the federal government doesn't allow them to share. You know, and for the longest time, Selangor had that situation. In fact, they still do to some extent today. You know, there's a level of information that's not available to them. And shockingly, the same level of information that the state health department is what is shared with the general public. By right, they should be able to get more information. We just have been told recently that because the state health director in Sarawak, for example, has just changed from what was basically a much more liberal and free exchange of information between the state government and the state health department, it is now basically deferring to Putrajaya. So they're holding back on information to be shared to the state government. And this is terrible because you cannot have this situation where political affiliation determines whether or not you're going to share critical information such as this, or whether you are answerable to Putrajaya or not. You should be able to share information like that with the state government. So we have this very harmful dynamic that continues to exist simply because Putrajaya insists that it wants control over everything. And we saw in the Sabah situation, for example, where the Sabah state health director, who was very popular and well-known, trusted, and it's very hard to say the word trust in this atmosphere of trust deficits, she was trusted by the people over there. She was transferred to Putrajaya, so supposedly as a promotion. And there was an uproar in Sabah protesting against her transfer. And they were arguing that this is for her to get promoted, but the reality is that you needed her to be in place to guide the state response. And you know what happened? She took early retirement rather than go to Putrajaya. She said, my job is to help Sabah, not to go for a cushy job in Putrajaya. You know, I'm needed in Sabah, and she resigned. You know, so this state-federal dynamic that we have going on right now, which we should be able to say stops at the water's edge during a time of crisis, the fact that it continues to persist is extremely harmful. And this is why we're seeing this roller coaster kind of situation in states that had previously done well, now not doing so well, simply because, you know, there is this difference to Putrajaya and not trusting in the state.
I think Jeffrey Kittingham has talked about the need for, and others have talked about the need for stronger state law to strengthen their health, their jurisdiction over health. Maybe we can pivot just a little bit back to the economy. So Dr. Muhammad, can you tell us a bit more about how COVID-19 has accelerated or slowed down some of the trends in Malaysia's economy, for instance, digitalization or, you know, the automation, things like that?
Yeah,
you must have something positive to say.
I'm struggling. I think we should call a spade a spade. Then the first step to solve any problem is to realize you have a problem. You take digitalizations. Yes, speed up. People say you use your e-wallet, whatever. But again, that's very unequal. The statistics I share with you, in Sabah, in rural area, only 5% have fixed broadband. How you expect them to do everything digital when the structure is not there? I think even if digitalization, it should be very inclusive. It should be fair, accessible, and it's not. The government did try to help. For instance, for children, they do through online learning, for instance. But the e-commerce is not there. Even in KL, we did a study for UNICEF. 9 of our 10 families only have phone for online learning. They do not have laptops. And even laptops, they have to share with their siblings. That's why many kids are no longer interested in school. So even digitalization, its speed up is not enough. The government promised about 150,000 laptops. It was supposed to be done. The finance minister, who repeatedly repointed, it says by February you're going to get it. It was announced last budget. By February you got it. Until August, not many people got it. So we like to use all the big words, digitalization, whatever words, mumbo jumbo words. But what is important to measure the outcomes, and the outcome is not fantastic. Azrul mentioned the outcomes. Azrul mentioned earlier on suicide. The number of suicide doubled compared to last year. And half of those who committed suicide are children, kids in school. They're stressed, they don't want to burden their parents. 50% who committed suicide are kids. If you cannot study, no digitalization, they say that we give up. And this is a lost, someone goes in a lost generation. We lost too many already. So unless you realize, you sit down and say, okay, this is the problem that we have, what do we do? The recommendation that we give to the government before is simple. Whatever it takes to solve it, whatever it takes. You want to increase debt, you increase debt. You want to increase deficit, you increase the deficit. You want to direct borrowing from central bank, you do it. But you explain carefully to all the stakeholders, to the public, to your voters, and to rating agencies, to international investors. Why are we doing this? And how do we claw back later on? But none of those happen because you don't want to meet people. Then there's a problem. So even digitalization, yes, it's going to be fantastic. But towards whom? Towards the rich people, towards those in urban areas, and not those vulnerable and those in rural areas. So it's going to make the gap wider in all sense.
Sorry, if I could just add to Dr. Muhammad's very important point there about the gap, the inequality gap. I'll give you an example, the Misdirection app, which is being used to sort of basically universal app for everything now, including vaccination status and so forth. You know, this requires you to have a smartphone, you know, and definitely for those who are able to afford a smartphone, that's great. But for a lot of people, they're still using the sort of Nokia type phones, especially older people, you know, where they require a certain amount of guidance to even install the app, you know, much less be able to use that app. And what we've seen is that the over-reliance of MySejahtera to be able to indicate your progress of, say, vaccination numbers implies that if you get the numbers that you have on MySejahtera, therefore you've already covered the population, in itself covers the fact that a lot of people are still signing into shops today, writing on pieces of paper or books, because they don't have phones or haven't installed the app, you know. And this is true for rural areas in Sabah Sarawak especially, and even in parts of Semenanjung, where this is still happening. So you have to ask, have they been vaccinated? Have they been, is there reach going out to them? Are they literate even, you know, because we're assuming everybody is literate when it comes to all these things, right? And most importantly is that if they are not in the government's radar, how are we then providing services for them? Because the government's having this over-reliance on the digital approach. And I couldn't believe the announcement recently, and this is not really related, but I just thought I'd mention, you know, that the government was going to remove 3G networks, and basically 4G would be the standard. And there's a ton of people still using phones that depend on 3G, you know, and at a time of crisis, this is what you want to be doing, which would deprive people of essential access to telecoms, you know. So, you know, this digital disruption that's happening right now is great, but it's leaving out a ton of people who cannot catch up. And we have so many stories of people who are forced to find a way to be able to do tele-learning, you know, going to remote areas, cycling just to get a signal for their phones. You know, we're romanticizing a lot of what this disruption is doing for telecoms without acknowledging the immense cost that it's having in terms of things like lost years in education. You know, I think Malaysia, the last time I checked, had 36 weeks of lost schooling, which is amongst the highest in the world. And this over-reliance on digital methods to somehow bridge that gap is asking a lot, you know, and expecting quite a bit, you know, because it just isn't possible to do.
Thank you. I think I'll just ask one last question so that we can move to Q&A, but we haven't got many questions left that haven't been answered in the Q&A. So my last question is for each of you. What do you think this whole crisis has, what is the impact on the public's perception and expectations of, you know, the public service, the health system, the political leadership, and in particularly for the youth, in particular for the youth, and which, you know, Dr. Muhammad had spoken very movingly about in terms of their circumstances. So maybe that's the last question for me before we go into Q&A with our audience. Dr. Muhammad?
I think what the crisis has exposed is, or shows, that the Malaysian public resilience in trying to mitigate the impact. They realize that they cannot depend on the political leaders, cannot depend on those who appoint political leaders and trying to be polite, or civil servants. We depend on ourselves. That's why, like, kita jaga kita, we take care of each other. It's widespread. Everybody help each other, even among families. The study that we did among the low-cost families, they pool the expenses together. They share phones for the neighbors' kids. So they become very resilient together. The camaraderie among Malaysians get better during crisis, despite that at the same time the politician or the ministers of the cabinet or those in power has failed, for lack of a better word, to deliver their mandate or to deliver their services. So I think this is the bright spark that came out of this crisis. And the race tension, the ethnic tension has minimized because everybody believes that we are in the same boat. And especially among the young. One of the questions also asked, I saw in the chat, about how would the young handle it. I think the young realize that they have to take it on themselves to improve. Would there be unrest if this continue? I would not discount that. If you look at other cases around the world over history, usually because of unequal distribution of among to the vulnerable groups. The question is, what would be the spark? That is the worrying part. You look in the Arab Spring, the spark is that the guy got a slap by the policewoman. That's all that it is. He got a slap, and it changed so many governments in the Middle East. If this not mitigated, if this continue, this is the worry. Social fabric of the country will be in trouble. Azrul?
Well, you know, for one thing, what has happened has been a very much a learning opportunity for many of us who've been looking at healthcare, and the disruption that it has caused is really an opportunity for us to talk about reforms that previously were just kicked down the road, you know, by previous governments, you know, hoping somebody else is going to do it. You know, we don't want to do it. Maybe somebody else is going to take on this burden. And what it has shown is the strengths and resilience, to use Dr. Muhammad's word, of our healthcare infrastructure in being able to cope with threats such as this one in terms of the public health context. And I give full credit and admiration to my colleagues who are working in the wards, doing vaccination, who are digging graves, who are doing testing, you know, going out in the community, because this is where Malaysia's real success lies. You know, it's not necessarily in the people there in Putrajaya, it's really the people who are helping each other. I don't really prescribe to the kita jaga kita because I feel that's a little bit too, you know, kita, you know, I feel it's rakyat jaga rakyat for me. So I see that we're able to depend on each other, but even then there's a limit to it, you know, because at the end of the day, we can only do so much. And the power of government is that it is able to address shortcomings. So you can see a situation where in Lembah Pantai, for example, maybe they're able to help each other because maybe they have better resources, they have a better member of parliament, they're also in the Klang Valley, but a similar place in Sungai Petani, for example, or Alustar up there in north, or in Sampurna in Sabah, you know, may not have that same benefit. I mean, people are trying to survive. You know, they have been denied opportunities for employment because of the numerous lockdowns, which have caused more harm than good. We've lost sight of what we're actually fighting for, because to a very large degree, the focus was on fighting the disease, but forgetting the people. You know, so you are very happy to impose quite restrictive draconian measures to control, supposedly control the spread of disease, but you forgot about providing support for the people who the measures harm. And you know, this goes back to the issues that we've raised during this discussion about where the priority should lie. And you know, the fact is that it's easy for us to say we're not in the driver's seat. You know, we're just analysts who are happy to give our opinions and you know, to whoever wants to hear them. But the reality is that I go to a point that Dr. Muhammad made earlier, is that the government needs to do consultation. It needs to jangan be bodoh sombong, you know. It has to not be arrogant, thinking it knows the answers, it knows it's best. And the fact that they use paternalistic language, you know, in the communications, you know, Abah, Pak Long, Abangah, and all this very paternalistic family terms, is very patronizing, and it implies that the brother knows more than everybody else, and whatever the brother does, you have to trust. and there is no need for consultation. I think that was a misstep from the very beginning.
Thank you. Thank you. Sorry, Eric, can we hear from you and from the audience? But I think most of the questions have been addressed. Eric, please.
Thank you, Ariel. Good morning, ladies and gentlemen. My name is Eric Santo Domingo, and I'm a research analyst for the Malaysia program at RSIS. So I'd like to direct the first question to both panelists, Dr. Azrul and Dr. Muhammed. How is Malaysia preparing to cope with an endemic COVID-19 and to fully reopen the economy? Dr. Muhammed?
Azrul, you want to take first? Is more health questions.
Well, this is going to be a tricky one because you're going to have to determine what are the indicators that are going to allow you to successfully generate confidence and trust in reopening different sectors. I give you an example, which, okay, I'm just going to use this. I know it's a little bit absurd, but bear with me. I've been trying to get my hair cut for the longest time. I couldn't get my hair cut, and I only just managed to do that last week. It was such a relief, except that you could only get a haircut. You couldn't do anything else. They weren't allowed to shampoo. They're not allowed to wash. And in fact, they secretly washed my hair in darkness because they didn't want that to switch on the light, because if somebody saw them washing hair, then it'd be against the SOPs, right? And they couldn't color hair and so forth. So if you're running a salon business, this is a lot of revenue that's being taken away, because that is where your business is really. A lot of people are wanting to do a lot of that. And the thing is that none of the SOPs that have been put into place in relation to restricting that activity has any basis in science. You don't know why you're actually restricting washing or shampooing or coloring your hair, but they restricted it. So the point here is that, the guys who are putting together these SOPs, which inevitably result in how we understand the reopening of the economy is going to be, we feel that they're sort of making things up based on the layman's understanding of what they think the disease is dependent on to spread. And so we get this very strange, very illogical kind of SOPs. And that goes the same for the indicators. So the NRP, for example, is supposed to be our exit plan. It's supposed to be able to look at the exit plan and be able to say very clearly to investors, to businesses, to chambers of commerce, to people who work in public health, okay, this is what we're looking at in order for us to safely reopen. And those indicators just blown within the first week of being introduced. And today, I would have to argue that we have to relook. In fact, I would say start from scratch. Just toss the NRP into the bin, start from scratch, talk to the people like Dr. Muhammad here to see about identifying indicators which you can say we should be able to measure and to be able to say this is good for us to consider if we want to reopen the economy. It's not just about public health, because right now, if we talk about the number of cases daily, we're never going to open, because 20,000 cases is going to freak people out. But what we look at is in terms of hospitalization, and we look at the number of deaths, because it gives us clear indications of whether or not our vaccination effort works. Vaccinations have a direct impact on the number of people who are hospitalized, needing to be ventilated, who need to be in ICU, and the number of deaths. Vaccines have a direct impact on those, but not necessarily on the spread of disease. So we need to be able to be confident in saying that even though we have a large number of cases, but we're protecting people, we're making sure everybody's vaccinated so that we can live with the disease in the same way that we've managed other diseases like influenza and so forth. So it's tricky. A lot of it has to do with trust. And the government must be transparent and consult as many stakeholders as possible. If it continues to do what it did in the previous administration, nobody's going to trust them. Governments are not going to reopen. You can forget about talking about green corridors or whatever. People will not be able to hang their hat on the word of the government if it maintains that kind of opaqueness and lack of consultation.
Thank you, Dr. Azrul. I'd like to address the next question to Dr. Muhammed. Given COVID-19's negative effects on the economy and Malaysia's fiscal position, what would be COVID-19's impact for Budget 2022 in the 12th Malaysia Plan? And how have priorities and resources been shifted?
What's the impact on the budget? First of all, we're gonna reduce our spending. Based on MOF projection, we really show that fiscal deficit would come down. We're gonna reduce spending, which I think is a mistake because we have not yet solved the economic issues. Unemployment remains high, still higher than highest in 30 years. Poverty remains very high, it's double for many states. And also jobs is not there. Firms are not doing well. You still must spend, and this is the mistake. I think the budget is going to be very conservative, and this would have put a lot of negative pressure on firms and households. So long-term implication would not be pretty. But at the same time, I do not foresee any drastic change in mindset in solving, using fiscal resources to solve COVID. We use money wrongly, not efficiently. I give an example. Last year, when they're drafting the budget, and we heard that they're going to give bonuses to civil servants, we said, stop. Why didn't you give bonuses to civil servants? They're not affected at all. The money that you want to give to civil as a bonus, not cut as a bonus, you give to small farmers or you give to self-employed. But no, you give bonus to civil servants. Civil servants do a fantastic job, but in the scheme of things, I like those words, scheme of things, they are the worst, they're the least affected. So use resources optimally. We did not see another instance, about 80 million, I think. It's not just the amount, it's in terms of priority. About 80 million given to psychops, to this entity, usually to counter all the social media items, JCOM, they call it, 80 million ringgit. The amount that we give to address mental health is 1/4 of that. It's a priority. You give 80 million for cyber troopers, but to sponsor cyber troopers, 80 million, but you give 20 odd million to those to address mental health. So the priority is wrong. Do we think that this will change? It will not change. So I'm quite worried on the budget moving forward. There are avenues. If you're worried about deficit, there are avenues for you to increase your income, to increase your revenue side. We talk about, in Malaysia, we talk about windfall tax. The government do not want to impose windfall tax because they say it would chase away foreign investors. That's short-term memory. We had windfall tax on palm oil sector since 1998. If palm oil price above 2,500 metric ton, we charge them a duty. For Sabah Sarawak, above 3,000 ringgit metric ton. This is about 23 years we have imposed that. For independent power producer, since 2008, if your ROA, return on asset, is more than 9%, we charge you 30%. So when any of this company run away? No, because the return is fantastic. There's avenue to raise, but we did not. There's also avenue to raise, let's say, from 5G. Singapore auction your 5G. We're going to give it for free. We're going to give it to the government entity. We created another entity. Not enough. We have Celcom, Axiata, all the companies that partly owned by Malaysian public and government through Khazanah. Now we create another company, Digital National Berhad, who has zero experience in telecommunication. We're going to give the license for them for free. We're going to lose a lot of money from auctioning. Not only you lose money from auctioning, now you have to pay others to do it for you. It's mind-boggling. So it's not that we do not have money. We did not spend it well, did not raise the value well. So if budget going to change, if there's a new people with good white hair surrounding the person, with good interest, I think I'll be more optimistic. Otherwise, the same thing. You're doing the same thing, expecting different results. We know what Einstein said, it's stupidity. So I'm less optimistic on that.
Thank you, Dr. Muhammad. Dr. Azrul, the next question is directed to you. What is your opinion on examples of decentralized health decision-making in Australia and Canada, for instance? They have resulted in barriers to effective and equitable COVID vaccination nationwide, including communication issues, distribution imbalances, and gaps in uptake.
Well, you know, decentralization is a model that Malaysia should consider, because there is the idea of centralization right now is to ensure that there is equity amongst the different states. I mean, that's the thinking behind it. But the reality is that there is unequal or imbalance when it comes to different states. You know, like states like Sarawak, Selangor should be able to manage health by themselves because they are rich states, and so the attention should go to other states. But dependence on Putrajaya basically makes it impossible for a state to then decide on their individual needs, to be able to respond to the community's needs for different kinds of clinics, hospitals, services, and so forth, because Putrajaya is going to look at its budget and say, oh, we can't afford that. You know, if you enable it to be decentralized, then even the state government can look at funding health at the state level, you know, and should be able to empower the state to decide on that and to have a say in the way it actually spends money on this particular essential service. Right now is that Putrajaya could decide. That's why we have huge gaps in infrastructure in places like Sabah and Sarawak, because you know you have weakened political systems there, and so all the decisions are made by people who have really appreciated the conditions of the rural areas in Sabah and Sarawak, and then they don't understand. They look on the map and say, "What's the problem? You know, from this point to this point, it's not that far. I can see it. There's a hospital there. Why can't they go to the hospital there?" And then person says, "Yeah, but to get to the hospital there, I have to travel 12 hours by four-wheel drive. I have to cross Brunei 3 times." You know, and they can't appreciate that. And that's why if we have it to be decentralized, there are possible opportunities for empowerment, but it will take away the power from Putrajaya when it comes to that. And I'm sure they don't want that. They don't like that. But imagine if Kedah could start funding its healthcare or jointly fund healthcare and have a strong say. Things could happen at the state level that could be vastly different because it now has additional funding that's made available that doesn't depend on the mercy of Putrajaya, you know, and look at the way allocation of personnel for these states as well. You have people in Sabah and Sarawak who complain that the people who are posted there don't want to be there. You know, people who are from Peninsula who are sometimes sent reluctantly to these postings and want to get out of there as soon as possible because they don't feel like they belong. Whereas you can have Sabahans and Sarawakians who, if the health departments there had a real say in it, could make sure that people who want to work in those communities are posted there. So, you know, these are some of the possibilities. You know, it's not new. We've been discussing this issue of healthcare reform for the past 40 years, and we're still discussing it because nobody really wants to spend the political capital in order to make some of these tough decisions. And we haven't even gone through healthcare financing, you know, which is also a hot wire subject. But the point here is that decentralization is something that we should seriously consider, especially in light of the disruption caused by COVID-19, because right now we're seeing states that are doing very poorly because their infrastructure and healthcare in those states are underinvested, you know, and that's not a result of last year's work. This is a result of decades of experience and the work that's been done. So those states shouldn't be in a poor state as they are right now.
Thank you very much, Dr. Azrul. I'll now pass over to Ariel. Ariel, over to you, please.
Thank you very much, Eric. And thank you to our speakers for a solid discussion. And I would like to say that I appreciate Dr. Azrul's reminder on diversity. We are committed to it and we are working on it. I would also like to thank our participants for staying with us. I would also like to thank our event team for their wonderful support. Have a good day, everybody. Thank you so much.